Hi, I'm Dr. Sabrina Brown. I'm an associate professor in epidemiology and research faculty at the Kentucky Injury Prevention and Research Center in the College of Public Health at the University of Kentucky. I developed the Centers for Disease Control and Prevention funded Kentucky Violent Death Reporting System, and I've served as the principal investigator since being funded in 2004. The KY-VDRS is part of the National Violent Death Reporting System, which is a system to combine data from across the country to shed light on the circumstances surrounding suicides and homicides. The system is used to identify those populations at risk for violent death. Suicide prevention has been a primary focus of the system. The national project includes outcomes to increase awareness to reduce suicidal behaviors in the United States. The KY-VDRS team produces infographics, data reports, peer-reviewed publications, and commentaries for local, state, national, and international use. Suicide is a leading cause of death in the United States and in Kentucky. In the U.S., suicide rates have steadily risen over the past 2 decades by an estimated 30%. Between the years 2005 and 2017, suicide was the second leading cause of death in ages 25 to 34, and the third in 10 to 24-year-olds. Suicide rates in the U.S. are consistently highest for white males between the ages of 25 and 34. Precipitating suicide circumstances between those same years most often included depressed mood, mental health, intimate partner, and physical health problems, and substance misuse. These known suicide risk factors will likely intensify as the risk of spreading the virus continues indefinitely. As we acclimate to a new way of life, we must be proactive and innovative in developing targeted pandemic suicide prevention efforts and messages aimed at our most vulnerable populations. Considering the second and third order consequences of the current pandemic, I, along with my colleague, Dr. Donna Schumann, published a paper entitled Suicide in the Time of COVID-19, A Perfect Storm. In the publication, we consider convergence of suicide risk factors amid an international crisis and introduce a new approach in understanding and preventing suicidal behaviors, a novel theoretical framework that can guide future research to include this added dimension. Social distancing is a traditional public health practice to reduce disease spread by reducing interactions between people in a community. In accordance with the White House's Coronavirus Task Force recommendations on March 7th, Kentucky Governor Andy Beshear called for social distancing for high-risk people. 4 days later, he extended stay healthy at home recommendations to encompass all Kentuckians. In weighing his decision to reopen parts of the country out of concerns for the economic impact versus continued social distancing practices through April, President Donald Trump warned of a potential uptick in suicide. It is critical to explore the Commonwealth of Kentucky's social distancing policy implications in terms of self-directed violence, which includes fatal and non-fatal suicide-related outcomes. We use I-cubed theory, which incorporates the pandemic dimension, in order to understand and prevent suicidal behaviors and guide future research in this new way. It encompasses intrapersonal, meaning comorbidity and psychiatric illnesses, interpersonal, meaning relationships, and then the added component extrapersonal, bringing in community, cultural, and geographical determinants. Dr. Eli Finkel's I-cubed model, not previously applied to suicide, offers enhanced explanatory potential over prevailing suicide theories for examining the impact of the COVID-19 pandemic on suicide. Including elements of the interpersonal theory of suicide and Durkheim's suicide theory, Finkel's I-cubed model is a novel and validated meta-theoretical framework that can model multiple and interacting risk and protective factors. These factors are operationalized as instigators, impellers, and inhibitors that either increase or reduce a proclivity to suicide. Perfect storm theory, or PST, a mid-range theory arising out of the I-cubed model, offers a way to test these three-way interactions through a mediator, self-directed violence proclivity, and an outcome, self-directed violence. This illuminates how at-risk individuals progress from thoughts of suicide to ending their lives. Pandemic-related suicide factors include social isolation, mental health problems, alcohol and other substance misuses, unemployment and financial loss, relationship problems and other loss, and access to lethal means. We are literally seeing a perfect storm unfold in front of our eyes as we keep up with current events. Preliminary data show that suicides in Kentucky during the weeks of March 13th to March 20th and March 20th to 27th were about 50% lower than the average of the previous 7 years. The rates have continued to be lower through July 2nd, 2020. The lower rate does not imply that the pandemic will not impact state, national, and international suicide rates. Historically, suicide rates decrease during the early phase or the honeymoon period of a crisis and during periods of high community cohesion. Following the honeymoon period, however, based on historical trends, rates will likely increase. Established disaster recovery frameworks can be applied to help predict where we find ourselves as the response to and recovery from this pandemic continues. According to the Substance Abuse and Mental Health Services Administration, the next phase in a disaster is disillusionment, as people realize the limits of assistance. As the crisis becomes chronic, discouragement, stress, exhaustion, and substance misuse may begin to emerge and increase. Also, increasing gaps between those that return to business as usual and those that have continued needs lead to feelings of abandonment. This fade can last months or even years. Thank you for joining me. The link to the full article is also included. Thank you.